Hello, students. Today's topic is anorexia, starving for control, and we'll explain what that means in the second slide. There is a lot of information in this lesson, you guys, so bear with me. I've organized the notes by slide so that you are able to reference the answer or the information on your notes with exactly the slide where it's coming from. So let's get started by talking about eating disorders in general. We're focusing on anorexia today, but I want to make sure that we have some information about eating disorders in general. So, first thing, people with eating disorders are also struggling with other issues. They're not isolated from other mental health issues. It may be a substance use disorder, drugs, alcohol addiction, some sort of PTSD, sexual abuse history, depression, anxiety disorder, OCD, obsessive compulsive disorder. There might be other health issues involved. Secondly, eating disorders are real. They are complex illnesses that cause real severe harm. In fact, anorexia nervosa is the number one killer of mental disorders. More people die from that mental disorder than any other. Eating disorders aren't a choice. People don't decide they want to be skinny, so they get an eating disorder. They're not a fad, they're not a phase. Eating disorders are also, Eating disorders are also more common than many people realize. And they don't usually just go away on their own. They don't resolve on their own. Like a lot of things, they need treatment, diagnosis. Fortunately, they are treatable, and we have come a long way in the time I've been teaching, talking about eating disorders with effective treatment for eating disorders. We have some really good centers right here in Minnesota. Dieting alone does not cause an eating disorder. Eating disorders are not dieting gone bad. Okay, that's not what they are. Eating disorders are not about vanity. This is not about, I want to look pretty. Vanity means being concerned about looking pretty. That's not what they're about. All right, so this is slide number 3. That was slide number 2. This is slide number 3. Types of eating disorders. Types of eating disorders. So there are compulsive overeating. These are 3 types other than anorexia. Compulsive overeating. This basically means that the person uncontrollably consumes a variety of food, often to the point of being sick. Okay. Typically, there's no purging behaviors. It's not like bulimia, which we'll talk about in a second. Bulimia nervosa is, again, food consumption, a lot of food, but then self-induced vomiting or laxatives or other methods. Generally, people who have bulimia aren't super thin. Okay, they binge and purge. They don't purge all the time. And binge eating disorder is, again, excessive and uncontrolled consumption of a particular food. Okay, people eating to satisfy some sort of need. So those are 3 types of eating disorders other than anorexia. Okay, this is slide number 4. These are some facts about anorexia. First of all, anorexia is an eating disorder characterized by very low body weight. It is a painful internal emotion of fear associated with the perception of one's own body, gaining weight, and food. Complications from anorexia are like complications of starvation, cardiac arrest, organ failure, electrolytes, fluid imbalances, which can affect your heart. Suicide also is a risk of somebody who has anorexia. Females often experience a delay in starting their period, or they may quit having their period. Other medical conditions are also present because of the side effects: anemia, dry skin. Anemia is low blood iron. Osteoporosis, which is the bones getting fragile and soft and brittle. Lowered body temperature, bad circulation, and even slow thinking, because the brain is shrinking because there's no nourishment, no vitamins, no nourishment. Everything in the person's regular daily life suffers because of this. It becomes their obsession, their life. This is really important, you guys. At its core, anorexia is about a need for control when a person's life is out of control. Several mental illnesses make a person feel out of control. Okay? Depression, anxiety, PTSD, OCD. This control of the weight, control of the number on the scale, control of the amount of food the person puts in their mouth is what seems to tap into that. The irony is, though, in time, the eating disorder takes control of the person's behavior, and they aren't even controlling the disorder. Okay, this is the medical definition of anorexia. This is slide number 5. The DSM-5, which is a diagnostic manual, which is used for, it's a place where all of the symptoms and signs of mental disorders are, and which ones count when you're diagnosing something. Remember, the only person that can diagnose a mental illness is a medical doctor. Okay? So, according to the DSM, these are the 3 criteria that must be present for someone to have or be diagnosed with anorexia. This is specific to anorexia. Number 1, restriction of energy intake. That's food, energy intake, to requirements for the person's specific body, leading to significant low body weight. In other words, they're very small because they don't eat enough food. Okay? And then, of course, it has to be consistent with age, sex, developmental trajectory, physical health. Remember, this is the medical definition. That's why the words are a little wonky. Intense fear of gaining weight or becoming fat, even though underweight. And thirdly, a disturbance in the way that person is experiencing their own weight and their own shape. They have a distorted image of themselves. All right, this is slide number 6. And slide number 6 is about signs and symptoms that we might see in our friends, in our classmates, things that students might do if they have anorexia. They may appear frail, thin, and emaciated. Emaciated means really, really thin. They may act withdrawn, depressed, anxious. So a lot of those same mental health concerns and the symptoms of those might also be present in someone with anorexia. They will eventually start to avoid social situations, especially if eating is a part. They don't like to eat in public. They will feel very self-conscious about their appearance, often wearing baggy clothes to cover up how they look. The person might demonstrate a very detailed knowledge of food facts. They'll tell you exactly how many grams of fat, how many calories different food items have. They are food experts. A person with anorexia may be lethargic or irritable and feel cold. They're not taking in enough calories to give them the energy that they need, so they're exhausted. Your body takes the energy it gets and prioritizes it. And energy to walk around isn't a priority when you're just trying to stay alive. They may feel a need to exercise, so compulsive over-exercising can also be a sign. And they might miss class, they might miss assignments due to the complications of anorexia. Become increasingly isolated as the disease continues to take control. They become increasingly isolated. And they may misuse diuretics, diet pills, or laxatives. And you may not see this, but a person with anorexia weighs themselves repeatedly, yet they're very secretive. And don't ask them how much they weigh. They're not going to tell you. They're very secretive about it. All right, that was slide number 6. Slide number 7 and slide number 8 are both a list. There are 5 recommendations for how to talk with someone who may have an eating disorder or someone even who has been diagnosed. So it's important to remember that when someone is suffering from an eating disorder, it isn't easy for them to change. This is an illness. If the eating disorder has left them malnourished, it can distort the way their brain's working. So we have to keep that in mind. They may be confused about your motivations for helping. Also, bombarding them with warnings about the health consequence of their eating disorder is not going to work. It is not going to be a good way to approach the subject. Telling them that they're starving themselves and they might die really feels like what you want to say because you don't want them to be hurting. But that person has put that eating disorder in a place in their life. It fills a role. Okay. And it's a way for them to cope with unpleasant emotions. So the allure to that eating disorder is very strong. I can't control my life, but boy, I can control what that number on the scale says. So you may be met with defensiveness or denial. So you have to tread really carefully when you bring this subject up, if you choose to. If you're a good friend, here are some suggestions. Number 1, pick a good time. Okay. Don't do it at the lunch table. They're probably not coming to the lunch table, but don't do it after a blow up. Pick a time that is calm, maybe a time when you're alone. Secondly, explain why you are concerned. Don't lecture or criticize. Refer to specific behaviors. Instead of "you don't eat enough," maybe say, "I saw that you only ate 2 carrots at lunch today. And that concerns me because I want you to be okay." Okay. Your goal is not to offer solutions. Okay. You need to tell them how much you love them and that you want to help. So that's 2 of the 5. Here's the 3rd. Again, be prepared for denial and resistance. There's a good chance that they're going to deny having an eating disorder. Okay. And they might become angry and defensive. Try to remain calm, focused, and respectful. Remember, this conversation might feel very threatening for the person with an eating disorder. Don't take it personally. It's not about you. This is very complicated. Ask if the person has reasons for wanting to change. Even if the person you care about lacks the desire to change for themselves, they may want to change for other reasons, to please someone they love, to return to work, return to school. All that really matters is that they are willing to seek help. And lastly, be patient and be supportive. Don't give up if the person shuts you down. They may need some space. Okay. The important thing is getting those lines of communication open and making yourself a non-threatening person for them to talk to. No judgment, no matter how out of touch they may sound. Make it clear that you care, that you believe in them, and that you're there whenever they need you. whenever they are ready. And by the way, this is also an important time to say you definitely want to get an adult involved. If in fact you are concerned, if this person in their journey with their eating disorder has not yet connected with an adult about it, because they can be very secretive, it is important to get an adult involved. So that's what to do. Here's what not to do. Okay, just to give you some preparation on how you can be the best support. Eating disorders are complicated and confusing for people on the outside and people who have them. So let's look at 4 things that we can remember not to do. Don't give them ultimatums, okay? The decision from change must come from them. If you say, I'm not going to be your friend anymore if you aren't going to get help, that's just more pressure. Okay. The whole point of them having a eating disorder, part of it is because of pressure. Okay. So you don't want to promote that secrecy. Don't give ultimatums. Also, avoid commenting on their appearance or weight. This is a tough one because it's the most obvious thing, but they're already overly focused on their body. Even assurances that they're not fat, which they, of course, aren't. That plays right into their preoccupation with being thin. Steer the conversation to their feelings. What are you afraid of? What do you think you're going to achieve? Why are you doing this? Thirdly, avoid shaming and blaming. Again, use I statements. Okay? I feel sad when I see you losing so much weight. I'm scared when I hear you throw up. Instead of, you just need to eat. Okay? You're hurting yourself for no reason. Those are tough things to avoid saying because it's really how you feel, but be very careful. Remember, that person's not thinking clearly, and how you talk to them can make a big difference. Lastly, avoid giving simple solutions. Everything's going to be okay tomorrow. All you have to do is accept yourself. These are complex problems that need to be handled by a professional. Okay? If it was that easy, they wouldn't be suffering so much. Okay. That's our talk about eating disorders. Please be kind to one another, love on each other, and until the next lesson, Gregor is out.